So there are many factors which matter for development of chronic infection. Those factors, viral disease, or environmental factors. There are some stages of the disease in a patient with chronic Hep B. And actually, there were a few old names, old terminology. On now, there is new nomenclature for a few years, and we divide primarily into two groups: Hep B E antigen positive group and E antigen negative group. So, for the patient who are E antigen positive, there are two stages: E antigen positive chronic infection or E antigen positive chronic hepatitis, depending on the ALT level or the inflammation going on in the liver. So if the patient has inflammation, inflammatory marker may be ALT, or it may be histological evidence of chronic inflammation. So if the patient has inflammation and is chronically infected and E antigen positive, so the disease is categorized as E antigen positive chronic hepatitis B. Otherwise, if there is no inflammation in the liver, ALT is normal and histopathology is also normal, we categorize it as E antigen positive chronic infection. So the treatment also depends on these stages. We will discuss later on after a few minutes. The other group is E antigen negative, or who are anti-E antigen positive patients. So E antigen negative, again two groups: E antigen negative chronic infection and E antigen negative chronic hepatitis. Again, the criteria for infection and hepatitis is the same. So here is a picture of surface antigen hepatitis B virus. So it's a DNA virus. You see the first one, the DNA, and surface antigen, core antigen. These are the antibodies. Surface antigen is the marker of infection. If the surface antigen is positive, that shows infection, and it's a major tool for screening. So we screen the patient initially with this antibody. Can be the marker of immunity. This can be the marker of immunity, or it can show chronic infection. Immunity may be due to previous infection, or it can be due to our vaccination. So this is a very interesting slide which shows when a patient comes with surface antigen, anti-surface antibody and anti-core antibody. So we categorize the results into some, we interpret actually this. He develops surface antibody. So there will be no core antibody. If the patient has only one antibody, that is surface antibody, that means the patient was vaccinated and it's due to the vaccination and the patient is immunized now. But similarly, surface antibody treatment simplified flow charts, you see. The patient may be surface antigen E antigen positive or E antigen negative. For E antigen positive, the criteria is more than 2 lakh international units of DNA, and for E antigen negative, the criteria is more than 2,000 international units per annum. So if the ALT is raised, treat the patient. But if ALT is normal, we have two options: either we monitor the patient, but if there is liver biopsy, if we do liver biopsy and there is evidence of any inflammation in the liver, so again we will treat the patient. So if there is inflammation in the liver, that means hepatitis, we treat the patient. If there is no inflammation, ALT is normal, histopathology is normal, we go for monitoring. So there are monitoring intervals we will discuss. So when to discontinue the treatment? So it's very interesting for cases of Hep B virus. Actually, we cannot discontinue the treatment for Hep B once it is initiated. There are reasons. But for the patients who are confirmed surface antigen loss, we are treating the patient, DNA is gone, ALT is normalized, and at the end there is seroconversion of E antigen to E antibody, and the patient also loses surface antigen. The patient becomes surface antigen negative. We should stop the treatment. This is actually an ideal goal of treatment we can achieve. There are other options that we can discontinue, but we need very close monitoring for such patients. It is for the patient who are E antigen positive without cirrhosis, stable E antigen seroconversion. That means the patient developed seroconversion from E antigen to E antibody, and there is undetectable DNA level, and the patient also completes more than 12 months of consolidation therapy after achievement of these targets. then we can discontinue the treatment. Otherwise, it's not the option.